My name is Dr. Lyndon Marani. I am with the USAID Private Sector Engagement Program, and we are working together with the government of Kenya. And we have just released a report called the State of the Healthcare Market 2024 report. This is a report that looks at the healthcare system, the whole entire healthcare system of Kenya. Where are we? And sometimes when people hear about markets, they start wondering, are you guys talking about business? No. Market simply talks about everything you're putting into healthcare, be it drugs, be it staff, be it hospitals, be it the training institutions. Are the people who are supposed to be getting the outcomes from it, getting the services from the healthcare system, are they getting it in a good and appropriate way? So we are looking at, is that entire system working properly? So this assessment actually has come up with some very interesting findings. Number one, the Kenyan healthcare market has done very well. We cannot lie about that.
This we do very closely with the government of Kenya, and it is important to note that in Kenya, we have a mixed health system where 50% of the population seek for health services from the private sector. It means we cannot ignore or leave the private sector behind. But what this takes is to really collaborate closely with the Ministry of Health.
KHF is a health board for KEPSA, and we aggregate all the actors. In the sector who are non-government, so spanning the entire value chain from hospital providers, clinics, people in local manufacturing for pharmaceutical and pharmaceutical, supply chain actors, just the entire value chain.
And the reason why this report is very special is because health is considered as a market. Sometimes we see healthcare as just service provision to community members, to the people, but we forget resources are needed for provision of quality health services. So we have different players in the health market, including the private sector, public sector, the not-for-profit sector, and as Population Services Kenya, we are playing the role as a not-for-profit sector, putting the patient right at the center for provision of quality healthcare services and bringing in all the key players, the government, development partners, the private sector, so that patients can get high quality services that is affordable.